Hi, my name is Steve Kilburn. I am the Grant Projects Director at the Chautauqua County Department of Mental Hygiene. I oversee the Chautauqua Substance Abuse Response Partnership, a collaborative effort of agencies from across our county working in prevention, treatment, recovery, and harm reduction, all working hard and working together to combat addiction in Chautauqua County. We have been putting together a series of videos we've called Let's Heal Together, Conversations to Combat Addiction, to help inform the public about what services are available here in the county, including the services that are available even now during this current pandemic. Well, I'm very excited about today's episode as we have two very special guests talking with us about the topic of medication-assisted treatment. Dr. Scott Cunningham is a physician at the Chautauqua County Mental Hygiene Clinics in Dunkirk and Jamestown, and Julie Apperson is a psychiatric nurse practitioner who works at UPMC Chautauqua. Let's turn now to our conversation with Dr. Cunningham and Julie Apperson. For those who might not know you, could you introduce yourself and what you do?
So I'm Dr. Scott Cunningham. I'm the director of the chemical dependency program here for Chautauqua County Mental Hygiene in downtown Jamestown, New York, located in City Hall on the 5th floor.
I'm Julie Apperson, and I'm a psychiatric nurse practitioner. I work for Jamestown Psychiatric, but I work at UPMC Chautauqua in their outpatient behavioral health services.
I am very fortunate to get to drive to Dunkirk one day a week, and I enjoy Dunkirk.
Primarily, I have been working with patients that have either independent substance use disorder or co-occurring substance use disorder and an underlying psychiatric illness. I have patients that I've been working with for a few years, and I see new patients almost every day. Sometimes we have crisis patients.
Healthy environment, non-judgmental environment. We welcome everyone, no matter where you're at in life, no matter what stage you're at in life. If you need help, just reach out.
It's really rewarding work, and I enjoy it.
Well, we want to kind of focus our conversation today on the topic of medication-assisted treatment, sometimes shorthand, MAT. So could you tell us about this? What is medication-assisted treatment?
I would say that medication-assisted treatment is really the use or the practice of FDA-approved medications in conjunction, though, with counseling and behavioral therapies to really provide a patient, a whole patient approach for treatment.
We use medications to help people through the withdrawal, through the physical symptoms, through the sickness. If we can get them feeling better and get them physically stable, we have a much better chance of engaging them in treatment. Nobody wants to do their counseling or work on some social or economic issues or personal relationships when they're not feeling well. So with the medications, we try and ease any type of withdrawals or ease any type of physical symptoms they may be having. And we find the engagement and success rate is much better if they do.
You hear the comparison very often about the person with diabetes. You're gonna, give them insulin, or someone with asthma, they need their inhalers. I mean, medication-assisted treatment is life-sustaining treatment for many people. And there also does not need to be any kind of limitation on that. For some people, maybe they only need it for a short period of time. Others may need it lifelong. It really needs to be a patient-centered approach. Medication-assisted treatment just saves lives.
You've perhaps heard it. I certainly have heard it. The idea that taking a medication to address a drug addiction, that's just replacing one drug for another. How do you respond to that sort of idea that gets often repeated?
Mm-hmm. You do hear that a lot, unfortunately, and it's part of the stigma around addiction. It's part of the stigma around anybody with a use disorder, whether it's opioid use disorder, alcohol use disorder. And that is part of the stigma we have to work with as a society and educate people. I mean, when there's a medication we can put someone on that is prescribed by a physician, that's FDA approved to treat an opiate use disorder, we are not substituting one drug for another. Addiction is a medical diagnosis. There's documented changes physiologically, biochemically in the brain, and it is not substituting one drug for another.
I tend to look at that through a biopsychosocial lens, and when we look at it that way, you can really make sense of where now a prescribed medication can, one, keep people at, safer from lethal overdose or negative consequences, but it also get people into treatment. So they can perhaps engage in counseling and have the support and start to work through all the reasons why, they made it down this path.
I think, one of the most compelling, if you will, arguments for medication-assisted treatment is its effectiveness. I'm sure I know the answer to this, but can you attest to the fact that you have seen in actual human experience that medication-assisted treatment really works?
Absolutely. And obviously I can't share those stories, but I think of many people that I've been working with for a few years now, and I had the honor of kind of going through their journey with them, and I have such a sense of pride in these individuals. Without going into detail, I can tell you that I know medication-assisted treatment saves lives, and it works, and I see that people improve the quality of their lives every day with it.
If someone's ready and we can get them in the program when they're ready and work with them, even if they're not ready, even if they're just kind of thinking about it, come in, call the office, come in, sit with me. We'll have a talk. We'll see where you're at. We'll see what you're thinking and what you want to do. But our program does do very well. We have very good success. The vast majority of my patients, they do very well. I see them. That's what I really enjoy about this line of work. The first time I see them, they're probably in some type of withdrawal. They're feeling rough, and they can't sit in the chair. Their nose is running, their eyes are watering, they're yawning. They are sick. They are sick, and we get them on some medication, maybe like Suboxone or buprenorphine. Next time I see them, they're like, "Doc, I should have done this a long time ago." I hear that all the time. Had I known these services were available, had I known your program was out there, had I known there was Suboxone out there, I would have done this a long time ago.
Let's say I felt like, I was in a place, if I had a problem, let's say with opioids, and I was in a place where I really, was prepared to reach out and get some help. How would I go about that?
We'd ask you just to call the office right now, and we'll get you taken care of. Get you linked with one of our counselors. We'll get an assessment rolling. A lot of times myself personally, I feel better having someone come in and sit down and talk with them, as long as they're feeling okay and don't have a temperature and aren't sick.
Sure.
Now, if it's something they absolutely don't feel comfortable doing that in these times, we can also do things over the phone.
At UPMC, we still have outpatient services available from 9 to 5, Monday through Friday, and people can access services still in person, or they can make a telephone call. We can arrange for a counselor or a nurse to speak to them that way. We can arrange for telepsychiatry. I see many patients via telemedicine right now. I think all of the agencies in our county have been open to that. So there are a variety of different places where someone could go to access treatment.
Still fully staffed. Again, the team here has responded tremendously. Everybody's bending over backwards to be sure we take care of everybody who needs us, and I'm just happy to be part of the crew.
I think that we've worked really hard as a community, Steve, your efforts and with the county and our leadership there to really develop a no wrong door kind of atmosphere. I've seen a lot of improvements over the years. Services are there. We can, if someone's looking for medication-assisted treatment, especially if that's for opiate use disorder, we can really accommodate and get people seen and determine a level of care and appropriateness for that really within sometimes even that very day.
Well, before we wrap up this episode, anything else that you feel like you would really want to speak, as if you were talking directly to somebody who is struggling with an addiction, maybe considering whether or not they should try to make some changes? What would you want to say to them?
I just say take a look at where you're at right now. Where are you at right now today? And every day is a new opportunity for change, and every day is a new beginning. Just pick up the phone, give us a call, see what we can do for you. I think you'll be happily surprised.
In a time where it can feel very helpless and hopeless, I think sometimes people could get wrapped up in all of that and forget or just not be aware that you are in a community that cares, and we do have help available to you.
Well, our thanks to Dr. Cunningham and to Julie Apperson for participating in this video and sharing with us about medication-assisted treatment. Medication-assisted treatment is available from several agencies across our county, and in some ways is actually more accessible now than perhaps it's ever been. We'll leave a list of agencies that do provide medication-assisted treatment to their patients in the posting with this video. We'll also leave some further information about medication-assisted treatment. Well, thanks to all of you for viewing this video. This has been a production of the Chautauqua Substance Abuse Response Partnership and Combat Addiction CHQ. Stay well, everyone.